Hi, I'm Kevin Harrington, an original shark from the hit TV show Shark Tank, and I'm here with Dr. Calvin Bojay of Calvin Medical. Dr. Calvin, how you doing?
Good to see you, Kevin.
Fantastic. Now, you've been a doctor for many years. How long?
24 years.
24 years. Amazing. In Salt Lake City area now, and you are helping people deal with some severe problems, pain problems. Well, tell us exactly what it is you do at Calvin Medical.
So obviously if somebody has joint pain, knee pain, shoulder pain that just doesn't go away, previous accidents.
Right.
They don't have to be 50 years old, 60, degenerated. They could be a sports person or just an accident at the age of 25.
Yeah, right.
And
all age levels, everywhere
all age
across
levels,
the board.
all age levels.
Yeah. And so now, what makes what you do a little different maybe versus some of the other people that are out there? I mean, you've been doing this 24 years, so that unto itself is probably a big differentiator, right?
Yeah, well, Kevin, one of the things I've noticed in the past 5-10 years is there's a big transition between the old ways of doing medicine and health. You know, people are tired of the drugs, the pills, the surgery, and with the advent of digital media and Google online, people can study and become their own doctor per se.
A lot of people figured that out, right?
And so people are beginning to realize, maybe I need to do some exercise. Maybe I need to go to a chiropractor finally. Maybe I need to lose some weight, you know? And with the new stuff we're doing, regenerative medicine, which is natural injections to the knees or to the hips or shoulders to help prevent knee replacements and just really phenomenal work to transform people's lives.
So you focus on the problem and then solving that problem in a fashion utilizing the strengths of your 24 years as a doctor. So that's great. I just got to ask you somebody's probably walked in that said, I've been to all these other places and have never been able to solve my problem. Please help. Right? And that's happened, right?
Yeah, I like to call it the cutting edge of technology nowadays. So if you can imagine this, imagine Christopher Columbus 500 years ago. Imagine what would have happened if he would have had a radar to detect the weather and GPS.
Sure.
How many sailors or people that would not have died? Shipwrecks.
Exactly.
So that's the cutting edge technology, light years ahead. So that's what I say about our clinic and this type of regenerative medicine, light years ahead of its own time.
Right. So tell me about a patient you've had that had been somewhere else, and now they're back on track.
Yeah. So
you don't have to mention any names.
Oh, yeah. So one of the recent ones that I can tell you about is a patient came in to our clinic a few weeks ago, and this person had severe debilitating low back pain.
Oh, wow.
Low back pain, and it was going down the left leg, I believe, and the numbness to the left foot.
Probably having a hard time getting out of bed. Right?
Yeah. Totally, I'd say out of commission.
Right.
And so this person, we also do another technique in chiropractic called muscle reactivation.
Okay.
So a lot of times what I think is people we can reserve the regenerative medicine, the injections, for bigger, harder cases. This person only received muscle testing and to determine which muscles of the knee, low back were not firing. If you can imagine the cylinders of your car not firing.
Sure.
You know? And so our doctors tested the muscles of the low back and turned these muscles on, so to speak.
Oh, wow.
Does that mean not just a chiropractic adjustment?
Gotcha.
And this person was probably 80% better within 2 weeks. And then the remaining left foot it's a little bit still there, but it's total
like almost
night and day.
100%.
And
that's amazing.
Upon X-ray, I'll just tell you the X-ray of this person. It was first of all the orthopedic test.
Right.
Everything indicated for the low back, a herniation for the low back.
Okay.
And then the X-rays indicated about a 90% disc degeneration of the lumbar spine.
Oh, wow. Okay.
So this is an easy candidate for surgery in the future, but this person is out walking, doing things that she wasn't not able to do
without surgery.
Exactly.
And I love that.
So within 2 weeks.
So somebody else may have said you need surgery, charged a huge amount of money, and she'd be maybe for many years and having some issues with that. In 2 weeks, you were able to go in, fix it. Unbelievable. That's great. So 24 years you've been doing this. Go ahead.
I'll tell you another case recently. So imagine this, and follow me. So this lady was referred by her 2-year-old.
Okay.
Can you imagine
All right.
that?
Yeah.
So, not exactly, but her 2-year-old was angry, mad at her that she could not pick her up anymore.
Yeah.
She was
Okay.
mad, obsessively crying every day and all day. And so this lady said, "I'm coming in here because
Yeah.
she can't handle her daughter, 2-year-old."
Unbelievable,
So
right.
her daughter, our doctors again worked on her muscles of the low back and just with some simple techniques of activating the muscles. We didn't even have to do the regenerative medicine for her low back or anything, but she, within like a week and a half, she was, again, 80-90% better.
Ready to rumble.
And she was,
Fantastic.
here's the proof of the pudding. The daughter, the 2-year-old, I guess this is a 2-year-old that can really speak
Yeah.
at the age of 2, but she was like, "Mommy, the doctor's helping you."
That's
I mean,
great,
that was the
because
quote.
A 2-year-old understood that.
Yeah,
That's pretty
yeah.
amazing. So, I mean, I think it's for anyone out there, no matter what issue you're having, 24-year track record, Dr. Calvin Boje, Calvin Medical. You're going to want to give him a call. His website is right on the screen below. Thank you for being here. I love sharing having you share some of the stories with all the folks out there, and it's amazing track record. Thanks for being here today.
Thank you.
Take care. Look at the website on the screen below and give Dr. Calvin a call. Thank you.